Prime Minister Justin Trudeau says he's focused on solving the problem of drug shortages using the most efficient approach, even if that means sourcing medications from other places in the world. He says he's not sure if ramping up domestic production of pharmaceuticals is the right answer, or if it would be best to get a more reliable supply chain and agreements therein. Canada has been experiencing a nationwide shortage of children's pain medications for months, leaving parents scrambling as rates of respiratory syncytial virus and influenza skyrocket. With us to discuss the spread of respiratory viruses across the country is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome to Forum Daily.
Pleasure to be here.
So what have you been hearing from parents yourself about the shortage of children's pain medications?
Well, right now we are seeing a major drug shortage of children's Tylenol, Advil, including all generic forms. And this is happening in the middle of flu season, RSV, and COVID-19. I know of a parent last week who went to 5 different pharmacies in order to get the medication for her child. So one theme I'm really hearing from parents is frustration and helplessness. It's tremendously hard to see your child suffer from symptoms that could have very easily been treated in other years.
It's interesting, and you're talking on children in particular here. Why do they seem particularly at risk from influenza and RSV this season?
Well, I think the rising numbers are definitely concerning here. We've seen 1 in 56 otherwise healthy babies are hospitalized now with RSV during their first year of life, and that was a study that came out of the Lancet recently. And the reason that we're seeing that increase is likely because many children were in fact shielded from common infections during all the multiple lockdowns. So in the past 2 years, the virus has now encountered a vulnerable population of babies and children who were sheltered from these common bugs during the pandemic. And that's why we are now seeing a large number of infections this year, and early infections at that, for both RSV and influenza.
You know, children are sheltered, but there's also, we're seeing rising numbers of older Canadians who are also suffering with these infections as well. So how are they faring through this season?
Well, respiratory tract infections in general are still the leading cause of death due to infectious disease in the elderly. And there's many reasons for that: waning immune systems, onset of age-associated organ dysfunction. So we're always particularly concerned about the elderly there. What we find in particular, especially in Canada, is those with COPD and other organ disease and above the age of 65 are particularly hit with these illnesses here.
What we talked about younger Canadians and older Canadians. Are there any other demographics that face a heightened risk of infection across the country in this season?
Yes, we typically see people with chronic disease, so asthma, heart disease, and stroke, diabetes, and kidney disease. We also have people with immune systems that are not up to peak, so HIV/AIDS and cancer, for instance, will have a decreased immune system for these patients. Other people include pregnant people, people living in nursing homes or long-term care facilities, and many racial and ethnic minority groups, including our Indigenous people, are at particular risk.
Some concerning information there for us all to consider. Now, we've been hearing a lot about infection rates for both influenza and RSV. For viewers at home, how can they tell the difference between these two different viruses?
So during winter, it's definitely common to come down with a stuffy nose or a sore throat. And every year we see a lot of viruses causing hundreds of millions of these infections. And we just call them colds in general, or cold and flu. But this year, what we're seeing is a cold. Could be COVID-19, it could be the flu, it could be RSV. So telling those apart is tricky. The only real way to tell them apart is to get tested, but your symptoms can give you a bit of a clue on what you would necessarily have. For instance, flu symptoms tend to start all of a sudden, whereas COVID and RSV tend to be a bit more gradual. And we also see fever, for instance, more common in flu and COVID rather than RSV in healthier populations.
Interesting. Now, moving to treatment here, what is the best way to treat these infections?
I think that's the first thing we should talk about, what not to do because of the shortage here. For instance, do not give your child adult strength medications. You could be severely overdosing them, and don't give your child aspirin because it can cause significant complications. But if you don't have the ability to get the Tylenol, Advil in cases of fever, you want to dress your child lightly because the excess clothing can trap a lot of body heat. Give your child a lot of fluids such as water, juices, and popsicles, and a lukewarm bath can also be very helpful in bringing those fevers down.
quick 15, 20 seconds, Dr. Raut, how can people stay safe this holiday season?
I think the most important thing here is prevention. So vaccination is still the best way from getting severely ill from influenza and COVID. So if your child hasn't been vaccinated for those yet, or haven't received the booster for COVID, I think now is the time there. And then finally, if you do feel a cold coming on, just get some rest, get a test, and stay at home.